guys, Michelle here from Supply with our continuing series on how to apply and use our medical products. This is the application video for the Breg Polar Care Cube regular knee pad. This is what a regular knee pad looks like. It's part number 04700. If you take a look at the endings here, you will see that there are two male endings on the Breg Polar Care Cube pads. All the pads are specific to each individual system and they are not interchangeable. So please pay close attention that you're getting the correct pad for the right system. In the package with your pad, you're going to get a connection paper, basically just telling you the same thing, which is to make sure that you got the correct pad and to look at the endings before you open the package. Once the sealed bag is open, it's not returnable. Also with your pad, you're going to get a skin warning. You never want to put the pads directly on your skin. You always want to have a barrier. Putting the pads directly on your skin could cause frostbite or some irritation. And it's important that you check with your doctor to know what signs to look for. The universal rule of thumb is 20 minutes on, 20 minutes off. So 20 minutes with the pad on your skin and then take a break for 20 minutes. And of course, you need to be able to check your skin regularly. Now, as we said, you need to have some type of barrier between your pad and the skin. There are sterile dressings available for the pads. This is the sterile dressing for the Breg Polar Care Cube regular knee pad. Once you open the package, you're going to pull your dressing out. The dressings are going to have tabs. You're going to remove the tabs and stick the dressing directly inside the pad. When placing the dressing on the pad, make sure to fully cover the pad so that no part of it is touching your skin. Once you have the dressing securely in place, you're ready to place it on the body part. The regular knee pad has two Velcro straps that are adjustable. So you're going to bring the bottom one across, fasten it, then we're going to bring the top one across and fasten it. And you can adjust these to loosen them or tighten them depending on your needs. The hose can go up or down depending on how you have the pad positioned and which is more comfortable for you. Once you have this in place, you're going to want to open your cooler and fill it with your ice and your water. Some people do choose to use frozen water bottles. Just keep in mind if you do that, you need to remove all of the labeling glue off the bottles because you don't want that to get caught in the motor and possibly void your warranty. We do also sell freezer bags. These are a very popular item and they're very convenient. They don't have any label or glue for you to remove. You fill them 2/3 of the way, you freeze them, and then you can fit about 3 of them inside the cooler. So we're going to put our freezer bags inside the cooler. And once you've done that, you're going to see a fill line, and this is where you need to fill your water to. Once you've put your water in, you're ready to put your lid on, and you're going to push the handle back, which locks it in place. Then you're ready to connect the hose from the cooler to the hose on the pad. There's two metal tabs that you need to push down before you connect it. When you go to connect it, you're going to hear that snap, and that means it's secure. Once that's done, you're going to take your power cord and plug it in to the back of the cooler, and then you're going to take this part and plug it into the wall. As you can see, we have our cooler up on a table somewhat level with the knee that we're treating. It's optimal to have it somewhat level with whatever body part you're treating, but you can also set it down on the floor or a chair if you need to. Thanks for following, and as always, if you have any questions or concerns, shoot us an email at cs@supplypt.com or give us a call at 1-844-505-8144, Monday through Friday between the hours of 8 a.m. and 4 p.m. Eastern Time.